If you're over 60 and noticing your arousal doesn't come as quickly, your erections feel less predictable, or your body just isn't responding to the kind of touch that used to work, nothing is wrong with you. You're experiencing normal physiology in a body that's earned its miles. I'm a physician who works with men's sexual health, and in this video, I want to show you how to masturbate safely, comfortably, and confidently as you age, while protecting your circulation, your prostate, your hormones, and your peace of mind. I'll also cover the 3 habits that quietly sabotage erections and a practical, science-backed plan to help you feel more responsive again. Stay with me if you've been worried about erection quality. There's a lot you can do. First, the big picture. Masturbation is a normal part of male sexual health across the lifespan. There's no credible evidence that ejaculation drains your hormones or harms testosterone. In fact, studies show baseline testosterone levels remain stable with regular sexual activity. On the other hand, stress and poor sleep do push testosterone down. That's one reason a calm, unhurried sexual routine can be helpful. There's also research suggesting potential prostate benefits. A large prospective study published in European Urology reported that men with higher ejaculation frequency through midlife had a lower risk of prostate cancer later on. Association isn't proof, but the signal is reassuring. And if you deal with tension, anxiety, or trouble sleeping, you should know that sexual arousal and orgasm activate pathways that ease stress and promote parasympathetic rest and digest tone, good for mood, blood pressure, and sleep quality. So why does it feel different now? With age, several normal changes stack up. The inner lining of your blood vessels becomes less responsive to nitric oxide, the chemical that opens penile arteries. Nerve signaling slows a bit. Skin gets drier and thinner. Medications add up. The time from touch to full arousal stretches, and the refractory period after orgasm lengthens. None of this means your capacity for pleasure is gone. It means your technique has to evolve to match how your body works now. More warm-up, more gentleness, more attention to relaxation and blood flow. Let's talk about the 3 mistakes that most commonly erode erection quality over time, especially in older men, and what to do instead. The first mistake is rushing. Many men try to get it over with quickly, often in a state of tension or secrecy. The problem is physiological. Arousal and erection are parasympathetic processes. Your body needs a feeling of safety to open blood vessels and let sensation build. When you rush, you breathe shallowly, your muscles brace, and your brain stays on alert. That sympathetic fight-or-flight state constricts penile blood flow. Over time, the nervous system can start linking touch with urgency instead of ease, which makes arousal more mechanical and less responsive. The fix is simple but powerful. Slow down and give yourself a runway. Even 2 to 5 minutes of arriving, phone away, door closed, a few deep belly breaths, shifts your body toward the state where erections actually happen. If you like specifics, inhale through your nose for 4 counts, exhale for 6 to 8, and feel your abdomen soften. That longer exhale turns down adrenaline. In performance anxiety studies and sex therapy research, breath work and present moment focus are foundational because they reduce the very tension that interferes with erection. The second mistake is using excessive pressure. As sensitivity changes, it's common to grip tighter or move more aggressively to feel something. Repetition trains the nervous system, and the penis adapts to that narrow, high-pressure input. Over time, many men find they can respond to their own hand in one specific way, but struggle with partner touch. On the tissue side, too much friction and compression can irritate the skin, temporarily numb the glands, and in some cases cause microtrauma. We also know from urology data that repeated penile microtrauma, most often from vigorous sex or bending, can contribute to Peyronie's disease in susceptible men. You don't need to be fearful. You just need to protect the tissue you want to keep healthy. Lighten your grip 1 notch and add a high-quality, unscented, water-based or silicone-based lubricant to reduce friction. If lighter touch feels empty at first, that's normal. Think of it like turning down a loud stereo so you can hear the subtler notes again. Give your nerves a week or 2 to recalibrate. The third mistake is ignoring the emotional layer. Shame, grief about changes in your body, fear of not performing, or a strained relationship with pornography, all of these raise sympathetic arousal, which is the opposite of what erections need. Research on male sexual dysfunction consistently shows that anxiety, depression, and relationship stress are independent risk factors for erection problems, and treating them improves outcomes. Mindfulness-based approaches and cognitive behavioral strategies have been shown in clinical studies to reduce sexual performance anxiety and improve satisfaction. This isn't about being soft, it's about removing the brakes. Start by naming what's really in the room: frustration, pressure, comparison, and then give yourself permission to practice without a goal. If that's hard to do alone, counseling with a sex therapist can be just as important as any prescription. Now, let me show you a safe, satisfying routine that supports erections and sensitivity as you age. Begin with privacy and cleanliness. Wash your hands, and if you use any devices, keep them clean. Set the scene to reduce interruptions. Warm up your whole body first. A brief shower, gentle stretching, or a few minutes of slow breathing while relaxing the muscles of your pelvic floor can make a big difference. Many men unknowingly clench the pelvic floor and buttock muscles when they're anxious. A soft belly and a relaxed pelvic floor invite better blood flow. Start with lighter, broader touch on the inner thighs, lower abdomen, and perineum before focusing on the shaft or glands. Add lubricant early to minimize friction. Use varied strokes and pressures rather than one repetitive pattern. If you notice you're bracing, pause, exhale, soften your jaw and shoulders, and begin again. Follow sensation rather than chasing climax. Some men benefit from what we call edging, allowing arousal to rise and fall without rushing toward orgasm. That gentle back and forth encourages vascular filling and can retrain sensitivity without overloading the tissue. If you're on a blood thinner or bruise easily, be extra mindful of pressure. If you notice persistent soreness, new curvature, numbness, or any skin tears, take a break and let things recover. If symptoms persist, get evaluated. Pelvic floor training deserves a special mention. Randomized trials and a meta-analysis have shown that targeted pelvic floor muscle training can improve erectile function and urinary control in men. The key is coordination, not just strength. Once or twice a day, practice a set of quick, crisp contractions followed by complete relaxation. Then a few slow holds, always finishing with a deliberate release. During self-stimulation, emphasize the relaxation phase. You want that area supple, not clenched. If erections have been unreliable, let's add a medical lens. Erectile dysfunction is often an early flag for vascular health, and multiple meta-analyses show men with ED carry a higher risk of future heart attack and stroke. That's not to scare you, it's an opportunity. Check your blood pressure, blood sugar, lipids, and waist size. Treating sleep apnea, if present, also helps. Studies show that CPAP therapy can improve erectile function scores. Lifestyle changes matter more than most men realize. A 2022 synthesis of clinical trials and observational studies linked Mediterranean-style eating with better erectile function, especially in men with metabolic syndrome. Systematic reviews of exercise interventions show that regular moderate to vigorous aerobic activity, think brisk walking, cycling, or swimming for about 150 to 200 minutes per week, meaningfully improves erection scores. Weight loss in men with obesity boosts testosterone and erectile function. Quality sleep and consistent stress management support all of the above. Medication review is another lever. Certain antidepressants, some blood pressure drugs, opioids, and medications for prostate enlargement can reduce erectile function. Never stop a prescription on your own, but talk with your clinician about alternatives that are friendlier to sexual health. When lifestyle and routine adjustments aren't enough, there are effective medical treatments. First-line options are oral PDE5 inhibitors, the class of medications that includes generics you've likely heard of. Multiple randomized trials and meta-analyses show they improve erectile function for most men with acceptable side effects like flushing, nasal congestion, and headache. Timing, dose, and context matter. Take them on an empty stomach when possible, allow adequate lead time, and combine them with the slower, more mindful approach I described rather than using them to force performance. Never combine these drugs with nitrates used for chest pain, and use caution if you take alpha blockers for the prostate. Your prescriber can help you sequence them safely. If morning testosterone is consistently low and symptoms fit, low libido, low energy, impaired erections, testosterone therapy can help, particularly with sexual desire. Meta-analyses suggest it provides modest erectile benefits on its own and can enhance response to PDE5 inhibitors in men with confirmed deficiency. The decision is individualized, weighing benefits and risks, and it comes with monitoring. Vacuum erection devices are a solid, drug-free tool. They draw blood into the penis using negative pressure. A constriction ring at the base helps maintain firmness. They're safe for regular use when you follow instructions and can be very effective either alone or combined with medication. There are also office-taught options like intraurethral or intracavernosal vasoactive medications, which can produce firm erections independent of nerve signaling. Success rates are high when used correctly. You may have heard about low-intensity shockwave therapy. Recent meta-analyses suggest it can modestly improve vasculogenic erectile dysfunction in selected men, but protocols vary widely and results are mixed. It's not a cure-all, and ideal candidates and dosing are still being defined. Platelet-rich plasma and stem cell injections remain experimental. High-quality evidence is limited, so I recommend caution outside of clinical trials. As for over-the-counter supplements, some small studies suggest potential benefits of L-arginine, L-citrulline, or Panax ginseng, but the effects are usually modest and product quality is inconsistent. If you try them, do it transparently with your clinician to avoid interactions. One more topic men ask me about: pornography and arousal. The evidence is mixed, but clinically I see that heavy, fast, novelty-driven stimulation can condition the brain toward a narrow set of cues. If you suspect that's part of your story, experiment with a reset. Shift from rapid scrolling to slower, imagination-based arousal for a few weeks while you retrain with gentler touch. Pair that with the breathing and presence work we covered. Many men notice sensitivity and responsiveness improve. Let me pull this together for you. Your body hasn't failed you. It's asking for a different playbook. Give yourself time instead of tension. Use lubrication and lighten pressure to protect sensitivity. Bring your nervous system into the equation. Relaxation is a treatment. Build a routine that respects your tissues and your mind. If erections remain inconsistent, think vascular health first. The same habits that protect your heart protect your erections. Modern treatments, from oral medications to devices to targeted therapies, are there when you need them, and they work best alongside the fundamentals. If tonight you try one change, let it be this. Slow your breathing, soften your grip, and let sensation rise without forcing a finish. Notice what happens when your body feels safe. In my practice, that's often where confidence returns. If this was helpful, subscribe and share it with someone who might need a calm, evidence-based voice on this topic. Your pleasure still matters. Your health still matters. And with the right approach, both can get better with age. Thank you for watching, and I hope to see you in the next video.